quick. Welcome everybody to the latest IGPM webinar. Today we're looking at the registering with a GP surgery service. Can I just politely remind everybody to make sure you're on mute if you haven't already done so. Much as I love to hear the background noise, it can be a little bit distracting. Before I hand over to our guest speakers today, this old dinosaur is just going to attempt to share her screen. And we're just going to go through. Hopefully you can see my screen has changed to the lovely IGPM logo. Has that happened? I hope so. Super duper. So I just want to remind people of who we are, if you don't already know. So Institute of General Practice Management, the only recognised professional body for managers in primary care. If you are not a member, please consider becoming a member. We do need your voice. We need your numbers. We need your membership. Now, if you bear with me a second, because there we go. Those of you who have attended our meetings before know our lovely faces. Mine, you'll notice, is an old photograph. This was probably pre-menopause. I was definitely looking better. It might even have been my online profile, how I captured my husband. But you know the four directors of IGPM. If you don't, please do make contact with us through our headquarters. So we're going to hand over to Adore and Ian, who are from the NHS England team registering with a GP service. There will be an opportunity to ask questions. Please remember that there is no such thing as a stupid question. You are probably asking the question that your colleague wants to ask and is afraid to do so. And we'll have a bit of a natter at the end. So thank you very much, guys. If I can hand over to you. And I shall stop sharing my screen for one moment. There we go.
Thanks, Nicola. Just bear with us. Well, there we go. Brilliant.
There we go.
So good afternoon, everyone. Thank you very much, Nicola, for that warm introduction. It's absolutely tremendous to be here with you today. My name is Ian Jones. I'm the product implementation lead for the Register with a GP Surgery Service. And I work within NHS England. Next slide, please, Serena. We're here to talk to you about our fantastic service that we've been working on as a team for nearly 18 months now. So I'll just do a very brief overview of what the service is all about, and then I'll hand over to my colleague Richard, who will give you a showcase of what the service is and all of the constituent elements, including the benefits. And there are a tremendous number of benefits for practices and patients alike. Nicole will then pick up and run with the demonstration and show you how easy it is, and it really is very easy for you to enroll onto our service, and how to get started. And it sounds more onerous than what it is, but literally within an hour or two you can be taking in the benefits of our service. And then we'll come back to a Q&A, which I'll manage right at the very end. Next slide, please, Serena. So just to provide you with kind of a plotted history of why we came into existence. So as you know, from those people who have been working in primary care, and I'm sure there are many years of experience within the room today, you know how difficult it is, how onerous and intensive the paper process is. And our objective was to make that process a lot more seamless, a lot more integrated, and to use the benefits of digital technology to get that information to you much more seamlessly, much more efficiently, and in much greater detail and much data-rich content for you. Because we do handle 6.8 million registrations on an annual basis for you and your colleagues. So the solution is, it's a digital service which has taken the GMS1 form, so the kind of the mainstay questions that you've been used to asking your patients for such a long time, but we've enhanced the service to ask much more greater variety and depth of questions that are needed to register a patient within your practice. So we now ask height, weight, alcohol consumption, SCR consent, to name just a very few of the new questions that we now ask, which we hope will negate the need for additional health questionnaires that some practices offer from their websites or hand out to patients who visit their practice. It's much more accessible. So we have a paper form equivalent. So the GMS1 form is currently being eased out of use for our enrolled practices, and we've replaced that with a form called PRF1 form. This is available from NHS Profile Manager, and it is the much fuller in terms of its data that we capture, which mirrors the digital solution. So irrelevant of where your application has come from your patient that's registering, if it's digital and the paper form, you'll get the same amount of data. It's so much more convenient for patients to use. So irrelevant of their physical or mental capabilities, whether they work multiple shifts, which cover your opening hours, whether they've got, they're not confident to come into practice and ask for forms, whether their English isn't their first language, they've got mobility or transport issues that stop them from coming into practice. Providing a digital solution that is available 24/7, 365 days a year is much more convenient, and it saves time. So for an example, if a patient uses NHS app, and I'm sorry if I'm stealing your thunder here, Rich, but just to give a user experience, they're what we call P9 validated. So all of their data has already been validated. If they go into our service from NHS app, all of that data will be pre-populated in the form, and you will be told data has come from the NHS app, and therefore you don't have to do any validation or verification on those patient details. So it saves the patient time in filling in the form, but most importantly, from a practice perspective, it saves you up to 9 minutes per registration, and that's on average. So you can see the benefits if you've got 10, 20, 30 registrations per week. Next slide, please, Serena. We currently have over 2,300 practices that are live across the country, and we've got ambitious targets for the remainder of this year where we hope to achieve a much greater take-up. So not only are you using a national service, you know that it's a service that is robust. So we're handling over 800,000 submissions to date, and on average a week we've got about 28,000 registration submissions coming through the service, and it's available. That service is available 99.7% of the time. So it's a totally robust, reliable solution that you can just run in the background and not have to worry about, and it works seamlessly for patients and practices alike.
Ian, could I just ask you a couple of questions while we're at that point?
Absolutely.
Just come through the chat. So so we've got a member here saying that an admin team member who completes the registration seemed to think that the service wouldn't be free of charge forever, and will there be a charge for using this eventually?
Absolutely not. So the registration solution is free of charge. All of our NHS products and services are free of charge, and it will remain that way for as long as we're here.
Fantastic, thank you. And somebody else is also asking, would they be able to download their own questionnaire to this service? And I'm guessing no. We have a link on our website for our own patient registration form, but we also do have the NHS registering service available to patients through the app. Am I right in thinking the two are separate in that way?
So, yeah, we're very aware that there are practices who do capture a lot more data than what's required for just registering the patient at a practice, and we'd love to be able to cater for all of those questions. What we have done is we've extended our question matrices far beyond the GMS1 form, which is what we started with, and we've added a huge on the feedback of our users. We've like I said, we've extended our capability and our function beyond recognition, and we will continue to work with that. But there are we do need to bear in mind that, one, this is a patient registration solution. So we need to capture the data that is contractually obliged for us to capture and give to you as practices. And we need to make sure that we capture that information effectively and efficiently so that it allows the patient to be registered with you to access the primary care services as soon as possible. And asking reams and reams of lots of other questions might delay that. What we would suggest is you have this solution as your first point of contact, and then you ask whatever supplementary questions that you need as a practice in an additional questionnaire that can also come in via email to digitize your solution. That's all from me. If there's no other questions specifically for what I've covered off already, I'll hand over to my colleague Richard, who will cover off the service showcase. Over to you, Richard.
Thanks, Ian. Hi, I'm Richard Sutcliffe. I'm product owner for the Register of the GP Surgery Service. So I've been working on this for the last year and helping we can expand the features that we have, taken from feedback from both practices and from patients as well. Serena, if you want to go on to the next slide, I'll just go through some of the benefits we have. So replacing the paper form probably sounds really easy, but there's a lot more to it. There's a lot more benefits that we can add as a result. One of the things we have is we have access to other NHS services. So services like Find a GP, the EDEC catchment area information, and so on, we can incorporate into our system. So what we see, because as a result of that, is that the patient data that comes through to you, where we've been able to put them through NHS login, we can do a trace, we can make sure we've got the right information, and we can pass that through to you. So we typically see around about 90% match rate before it gets to the practices. We also work with Primary Care Support England to look at the exceptions we could cause problems with registrations after the practices have entered them. And so we've worked with them to look at ways of fixing those issues before they get to the practice. So asking relevant questions, doing relevant checks that we can do, and using existing data where we already have it. As Ian's already said, the system is free to use. We've also recently introduced patient notifications, which again are free to use. And those are helping patients to see a little bit more transparency from the registration process. So once the practice has entered the patient's records, whether it's either paper or the digital form, we automatically pick up that information and can send that to the patients if your practice opts in. We're aware practices have things like AccurRx and other systems to do some of this messaging, but this really just takes that headache away from you. We can put it as part of the service automatically. We've also introduced functionality to work with automation. So we've worked with a couple of vendors, such as HealthTech One, GP Automate, and Modality, to look at how we might be able to automate the registration, so our forms can go through to their systems and be entered into your systems automatically, and that can save your practice lots of admin time. And like I said, we get the integration with those central services mean that new patients or patients that are moving house, looking for a practice to join, and are using the NHS, either the NHS app or Find a GP service, can see your link straight away through that service. And what we're seeing is a lot of patients who want to join out of hours at a time that's convenient to themselves will gravitate towards those practices that offer online registration. And we've seen evidence from other practice managers say that that's increased their list size as a result. I think that's it for this slide, Serena. Okay, so one of the things we had to address once we started implementing the service is looking at the catchment areas. So all practices fill out these to say, okay, what areas they're covering with support commissioning. But what we found is that we were the first service to really actively use this to help patients locate practices that are close to them and register online. We found that there's issues with around about 30% of the practice boundaries that are in there, and it's really down to the software that's used to collate those boundaries. There was issues with the areas not being complete or having overlaps and so on, which caused problems for computers trying to interpret that information. So we've fixed that as a result of the work we've been doing. We also found that around about 80% of the branch sites didn't have any boundaries described at all. So we've put in a fix to inherit that from the main site where it's applicable. We've recently introduced features to make sure that we get where practices can't accept out of every patient, so patients are blocked before then. So again, hopefully reducing some of the admin pain that was around that area. Serena, if you want to go to the next slide. I won't read through all of these, but we do now support around about 1 in 3 practices. We see about a third of the registrations that are made by people either on bank holidays or out of hours. And we also see that, that about a third of the practices, sorry, a third of the patients that apply are authenticated users. So they've had, they've gone through the NHS app either during COVID or afterwards. They've done their authorization with a video link and a passport. And so it means that a lot of those patients that are coming through to yourselves are already authenticated, have already had checks applied against them. So again, hopefully making the admin role simpler. Come to the next slide, please. So for patients, I won't labour the point on convenience. We are also looking to try to avoid unnecessary applications. So things like patients applying to a practice they're already with. You'd be surprised to see how many of those actually come through. So putting in place checks to try and stop those. We have had a few people who've seen the service as being either something like patient online or system one online. So we're taking pains to try and avoid patients thinking that we're part of that service, and we're also pushing patients who have urgent needs to the NHS 111 service where applicable. Again, hopefully taking some of the admin and some of the burden off practices. As well as the digital service, we've also got the paper form. That is now being made available to patients as well as practices, and that will be aligned to the digital service. So what you'll see is for practices involved with our service, the same questions will be asked by the paper form or the digital service, making it easier for you to enter into your systems. If you go on to the next slide, Serena, please. I won't mention too much about this, but obviously the NHS app has been wildly successful. There's about 33 million users, with 25 million people, I should say, logging on each month. And again, if you think about those people who are moving areas looking for a new practice to join, if you're involved with our service, then it's automatically highlighted and find a GP. And it means that patients are more likely to pick your service over practices that aren't enrolled. Next slide, please, Serena. Again, I've mentioned the paper form already. Should say because the paper form does include lifestyle and healthcare questions, and the request for those to be included came from both patients and GPs. Obviously, patients want to just do the registration, answer all the questions that they think are necessary all in one go. And obviously, practices want to have all the information they can have to do the clinical follow-up and the due diligence that's required. So our paper form and our service tries to measure that need. As Ian said, we have to sit on the fence according to the number of questions we can ask and how many questions we can make mandatory to make sure we don't include any barriers for anybody, but also to make sure that people actually want to complete the service, because the questions we have 30 or so questions in the service, on the digital service. There's a lot of things for people to answer when they want to make the kids' tea and stuff like that. So we want to make sure that people have time to be able to complete the form. Next slide, please. I think this is the last one. So this is the notification service that we've introduced recently. So this uses a number of different channels to get to notify to patients that you've accepted their application. It goes in order by, so if somebody's already logged into the NHS app, it can send them a notification via that. Similarly, if they're not on the app, we'll send them an email if we have those details, text if we don't have the email details, or traditional letter if needed. And again, that's a free service. It's automatic if you're already rolled in. You can opt out if you've already got services that you use, but hopefully it's something that, again, makes patient and practice lives easier. Any questions?
Thanks, Richard. Yeah, I was having a little chat in the background with Hassan about the questions. So one of the things that we've noticed is that occupation is not asked as a question. And I understand that there is a prioritisation around health questions.
Yeah.
Some health issues are related to occupational hazards, though. I'm thinking, and largely, you know, for an older generation, things like asbestosis, for example, where we would have had a generation of men and women who were working in buildings with asbestos. How would requests for changes or additions and amendments to questions be fed through? Will we have a mechanism to do that as a product request, really, I suppose?
Yes, so we've recently done a GP survey to all our enrolled practices where we've asked how practices feel about the service. So the usual sort of 1 to 5 score, satisfied to not satisfied, but also asked for feedback to say what are things we aren't doing well, or you know, if there are things doing well, okay, what we're doing well. So we take those. We have to look at the numbers. We need to look at who's asking. And then that is then triaged into the prioritisation process. So occupation is one, again, that we've highlighted is something that we need to look at for the reasons you've mentioned already. So it's probably likely to fall into the roadmap in the next financial year, so after April. And that's purely because, as you probably expect, in the National Service, we get lots of these requests. The way to increase the priority on that is to come through groups like your own, but also the more practices that ask the same feature, the higher up the list it goes.
Thank you, Richard. That's brilliant. So for people listening who are members of IGPM, please send in your requests to us, and we will nag the team accordingly. So thank you, Richard. That's really helpful.
Thank you. Cheers. I think I'm handing over to Serena next. Oh, sorry, Nicole.
Hi everyone, my name is Nicole. I'm part of the onboarding team, and today I'm going to try give you guys a demo. So I'm going to try steal the screen. Hope that works. I can't see anything, so I'm hoping you can see a Find a GP page.
Yeah, we can, Nicole. Thank you.
Lovely, thank you. So if you were to enroll with our service, you receive your own unique URL, which you can go ahead and place on your practice's website, but we will go ahead and place it on Find a GP for you. Now, if you're not aware of what Find a GP is, it's basically a website that a patient can use to find a list of practices that are within their catchment area. So if you were to enter a postcode here, you'll find a bunch of practices when it loads. Yeah, so find a bunch of practices that are covering your postcode. Now, a practice that is not on their service, if a patient wants to register here, they would have to click on this page here and then follow the information on the screen. However, for a practice that is on the service, the main difference is that this massive toggle will appear. Now, this toggle basically allows the patient to click on it and now direct them straight to that practice's unique landing page, which then they can go ahead and make a registration. Now, the landing page itself will have register with a GP surgery at the top, followed by the practice's name. And then there's a bunch of information for the patient to read before they make a start. So I'll give you a quick user journey of what happens. So if I was to click start now, the first question that is asked is who is registering with a GP. Now there's two options here, myself or someone else. Now, someone else is mainly there if you're, for example, registering a child, or you may be a carer registering on behalf of someone else. Now, depending on the answers that you fill in, you'll be asked slightly different questions, and that will take you slightly down slightly different user journeys. I'll show you a bit about that later as well. So I'm going to do myself and press continue. And then we asked, would you like to sign in with NHS login? So as Richard and Ian mentioned earlier, the patient can use NHS login, but it's not mandatory and it won't affect the PDS matching that happens in the background. But if the patient does use the NHS login, you can be assured that their identity has been verified and that they'll be matched to their NHS number, and that'll also be shown to you in the patient email that you receive. I'm going to do continue without, and then we ask, what is your name? So I'm just going to quickly just fill this in, and then we ask, what is your date of birth? We then asked, do you know your NHS number? So just another opportunity for the patient to enter this information if they know it. We have a little drop down box here where they can find out where the NHS number may be and what it looks like if they're unaware. But once again, if they don't know it, we'll carry on doing the PDS matching in the background to try and locate that as well. So once they know and continue. And then we ask, are you registering with a UK GP for the first time? So like I mentioned earlier, depending on what you asked and answer, you'll be asked different questions. So if, for example, if I was to click no, then some questions around my previous GP will be asked. But just for today, I'm going to say yes and continue, and then press continue once again. And then we ask, do you have a current UK address? So this also includes temporary address as well. So if I click yes, we'll be asked to enter your current UK address. So it asks us for a house number or name and a postcode because the service is integrated with an address lookup system. So I'm going to enter a postcode here. Let's continue, and it will find addresses that match this. If, for example, the address can't be found, then there is an option for the patient to enter manually. But I'm going to click the first one, and I'm going to show you a bit about the catchment area. Now, as Richard mentioned earlier, we kind of implemented a new catchment area feature. Now, if the practice doesn't have a block on catchment, so they want to allow patients that are outside of catchment area to still apply and register, then this is the page that a patient will see. It does warn the patient, it does let them know that they're outside of area, but it lets them know that they can continue the registration, but they may not be accepted. And then it prompts them either to use Find a GP to find a practice within their catchment. However, if the practice has a hard block, which you can enable yourself, it would actually just block the patient completely at this point. It will let them know that actually they're outside the catchment area and they may need to use Find a GP to find a practice that is within their catchment area to then go ahead and apply to. So you can actually turn that on and off yourself as a practice. Now, we also asked a bunch of other questions. So we asked things like ethnic group, ethnic background, questions around your emergency contact, and then we have a bunch of health questions. So we have our height and weight question. We have questions around alcohol and smoking. We also have a summary care record question at the end, and then some questions on like allergies and mental health conditions. And like I said earlier, we have different questions based on different user journeys, and that'll be detected based on the answers that you input. So we have things like UK citizen returning from living abroad, under 12 months, under 18. And then we have 3 configurable questions that you can turn on and off yourself via Profile Manager. And then 3 questions you can turn on and off based on if your practice offers these services or not. Now, once an application is submitted, you'll receive an email to your shared mailbox, and in that email, have all the patient details. The email will also have a PDF, and the PDF will look something like this. So at the top of the PDF, you'll get the NHS number that will be found, and then it will give you the registration reference number, the type of registration, and also the date and time it was submitted. And then it will give you 3 main things. So it will let you know if there was a PDS match. So as seen here, it will let you know if their identity has been verified. So that's based on if they use the NHS login or not. And then for a practice that doesn't have the hard block of catchment, it will let you know if they're in or outside a catchment area, and then you can decide what you do from there. Now, all the information by the patient will be neatly laid out for you in this patient email. And at the moment, what you will do is you'll copy and paste this information into your clinical systems and then carry out your usual registration process. If you wanted to reject someone, you can contact them using the contact information provided and let them know that they've been rejected. We have a little bit here on consent to contact, so you can kind of figure out what they've given you consent to, and then you can contact them as well. Now, we are working on an integrated model, but it's just not quite there yet. But if you do wish to integrate this, we have a couple of RPA vendors that you can integrate this information into your clinical systems too, and we can kind of put you in line and into contact with them. So let us know if you are interested in that. Now, I'm going to go a bit about how to enroll. So I think some of my colleagues have put this link in the chat, but we can put that again anyway. But signing up is really easy and it can be done within 10 minutes. Now, you can sign up via NHS Profile Manager. And we also have like a little video here that can kind of guide guide you through it and show you step by step on how to do this. And then once you've actually registered, we also have a video on how to manage it and pause your registration if you wish to do so. The video is very easy to follow and self-explanatory, but once again, if you do ever get stuck, then anyone can always email us, and we're happy to guide the practice there as well. I'm happy to answer any questions anyone has. If not, over to Ian. But yeah, I can't see the chat right now, so I'm going to stop sharing my screen.
Yeah, I don't think there's any questions for you specifically, Nicole. They've been the conversation has been drifting.
No
I just put a little point in as a practice using the service. You know, the block is really helpful. We do offer out of area registrations. But we, you know, we still have to be restrictive on how far that out of area goes. So it's really handy to retain that control. And any practice managers on here will know, you know, good practice managers are OCD freaks, or that might just be me as a control freak there. But we do need to retain control, and I think this system is really complementary. And it's very quick, and the feedback that we've got from patients has been really good. It's just it just fits into their day. They don't feel the need to have to drive to the surgery and fill out a form. They don't feel the need to contact us during office hours. And as one patient said to me a little while ago, well, if I can order potatoes from Tesco at 2 o'clock in the morning, why the hell can't I register with a surgery? And I said, well, actually you can, because you just go here. So that was quite nice to do that. But,
you'll be stealing our jobs, Nicola.
No. No, I often say I'd have a fantastic job if it wasn't for the patients and the doctors, actually. But we make the best of what we've got. But thank you, Nicole. That's great.
No worries. Serena, do you want to take the screen back?
Yeah, but just to add to that, Nicola, I think you've raised a very pertinent point there in terms of the control. We are very aware that practices are very, you know, and there are reasons why that control is there. It's because they don't want to be barraged with patients. We've done a lot of work, as Rich has alluded to, in terms of getting it right for the catchment areas, so that you know, this is going to come with trust. And if you do sign up with us and it's not quite right for you, you have the power and capability to pause and let us know what's not quite working for you. But you know, from the work that we've done and the feedback that we've had from Nicola and our 2,500 nearly users, we feel that we're getting to a product now that we've gained the trust of those practices. They've understand what the work we've done, and it's helping to support them to let that control go, so that they can turn their attentions to the other value-adding areas that require their attention and their focus within the practice and with their staff. So just on that, happy to take questions and answers. We're getting to that point now where we can open the floor, but just to let you know what other stuff is available for your perusal and your use, we've got an extensive library of reference material on our resource hub, which can be accessed by clicking the link at the topmost highlighted text there when you get the packs. It is full of stuff that we've made available for practices and to make it easier for you. So there's a lot of reference material there for posters, etc., and producing pamphlets. So a lot of the success we've had with practices who use the service, they've created a little pamphlet or a poster that sits beside reception, and when a patient wants to register with the practice, they've offered the digital solution to that patient. If they've got a smartphone handy, which they generally have while they're standing in reception, you know, they're looking at their Twitter feed or their Facebook or X or Facebook or Insta, it's easy for them to just click on a QR code, and they can even fill in the form while sitting in the comfort and warmth of the waiting area, and do that. And that's worked magnificently well. So we've got posters and that's there. We've got blogs, we've got testimonials, we've got testimonials from other national bodies such as Health Watch and National Voices. Hopefully we'll have one from IGPM very soon. We've got testimonials from other practice managers like yourself who've been through the process and understand what it takes and have started to gain a huge amount of benefit which they're realising by using the service on a day-to-day basis. So please do peruse that. And just right at the very bottom there, we do have a GP practice community webinar that we're hosting again at the end of February or mid-February. So please do sign up to that. And we'd love to have you again in our presence to show you, if you've not convinced already, how good our service is and how we might be able to support you in your move to a digital new patient online process.
Thanks, Ian. There was a question from one of our attendees, which Richard has answered, but just for clarity and for everybody. So Laura had asked about, about, because that registration form isn't integrated, how does the patient get that text or email that says, welcome to the practice, you are now registered? Richard, I know you have answered this to Laura directly, but would you mind just letting everybody know? Is that okay?
Yeah.
Jump in, Rich.
So because we're integrated with the NHS, we get data systems in the back end and other services. As soon as the GP or somebody within that practice enters the patient details into EMIS or TPP and updates PDF, the personal demographic service, we get sent a message to say because there's been a change made. And so we can then check that patient against the practice's ODS code, and if they've opted into our service, we can send a notification. We base that on the contact details we've got in PDF. One thing that we've been able to add as part of that is we now look at the details on PDFs that were previously in there. We can, if there's changes, a lot of changes made, then we can also notify the patient, just say, is this you? And we've been able to capture where we can have impersonated other people, or where people have been trying to register, say, a child, and there's been a custody issue. So we've got additional checks that have gone in there that, again, hopefully helping the practice and hopefully avoiding some of the unnecessary burden we could see otherwise, just because we have that integration and we have the backing of those national services.
Brilliant.
Thanks,
Thanks, Richard.
Richard. And can I just ask, what's the timeline for that process? So let's say it's Sunday night, the patient has done that registration form online, the practice opens up on Monday morning and gets that notification. Now, assuming that there is an admin person who is dealing with that form at their end, what's the actual confirmation bit at your end?
Yeah, I mean, we can see those changes on the data in almost real time. So typically we will send a message to our message handler within 3 hours. And so as long as it's not a letter, which also takes longer to go through via mail, we can send that message straight away. So typically people see a message within the same 24-hour period.
Okay, that's great. It's just that occasionally we will have those patients phoning saying, I've done the registration, I want to book an appointment, and you can't find them on your system. So it's just nice to have a time frame of, if we sort of said 1 to 2 working days, should absolutely see that registration process being completed, assuming that you've got the team in the surgery, of course, and that not everybody's gone off on with COVID.
Yeah, absolutely.
There's another question here to ask us, what happens at the practice end when a patient uses the service? Would you be happy for me to answer that as a
absolutely
person? So just to say, so we get we've linked the system so that we get an email in our generic letters account that is checked by my admin team that says you've got a new registration to deal with. A member of my admin team processes that form to really just, and really the checks that we're doing is have they filled out everything that they need to fill out, so there's nothing missing. Importantly, where are they living? So are they in our catchment? Have they slipped through? Is there an issue? And then we just get the patient on the system, and as Rich has alluded to, that within a working day they get a message to say that they're registered. So we're a tiny, down in the back end of Cornwall practice. We still have paper registrations because I still have a lot of people who don't want to use the online service, and we use this as complementary, not instead of. Using this online system doesn't take any more time than it would to transfer that data manually from a paper registration that you might get through the post. So it's just exactly, I'd say, you know, is it a little bit quicker? Probably, depends on the person doing the processing, but it's definitely not any slower. There's nothing that impedes the process. We've got a system in place. As I say, we know what we're looking for. Get them on the system, and you're done. Hopefully that's that answers that for you, Victoria. And Dawn asked about the benefits to the surgery compared to using an automatic registration system. I'm not sure what you mean there, Dawn, by an automatic registration. Perhaps you guys would know.
Yeah, it'd be good. It'd be interesting to know what she means by an automated. So there are, as we've alluded to, so there are RPA vendors which we work with who can provide that semi-automated feed from the kind of the submission straight into your GP clinical system. There is no direct integration solution. We are working on that with the providers, and we should have some further news on that as we move further into the year. So we are expecting the first phase of the GP integration, so the integration from our service into the GP clinical systems sometime late, kind of Q2, early part of Q3 this year.
That's great, thank you.
Yeah, just to pick up on that, Nicola, we are very aware that, you know, there are some admin teams who aren't that kind of confident with using tech, and maybe kind of still want to print out that form and type it in from the form. But if we can encourage admin teams to use cut and paste, so the Control V, Control P, and or use the right button of the mouse to pick up that data, we can save up to 9 minutes. And we've done a lot of time and motion studies in comparison to typing in to using Control C, Control V in comparison, and we can save up to 10 minutes, but obviously that's dependent on the skills of that person. So, you know, it's not going to take you any more time than typing it in, but there are significant other time-saving benefits in terms of the validation and the quality of the data that you get, because we do all the validation and verification, so you don't have to.
Okay. So, yeah.
So on the GP integration, we are also dependent on EMIS and TPP, who've obviously got their own roadmaps and things they want to introduce. So we do have a dependency there. That is the thing we want to do, but the thing we need to be aware of there as well is obviously making sure that practices retain control. Because obviously if patients are popping into your system, you're not aware of them, that's going to be an issue. And obviously the healthcare data, you might want to review that and then have a clinical follow-up as a result. So we're trying to make sure we're building all of that in. So hopefully that gives you a bit of confidence.
Thank you, Richard. And a question here about training available for admin teams processing the registrations. Is that easy to access?
So we don't offer any kind of bespoke training. You know, in terms of if they do need the support, then obviously for any of our users, we've not kind of literally dropped them in like a bombshell and disappeared into the distance. But like I said, if there are teams struggling with the technical capabilities, we'll be happy to kind of work with them. But you know, it is kind of you getting used to the Control C, copy and paste functionality that's inherent within all kind of data processing applications now. And if you're not confident using that, then, you know, typing that information in from the form will suffice.
Yeah, I must admit, from a user perspective, it's really quite straightforward to follow. I think the key thing that I would say is have, as management, have a chat with your admin guys as to how you want to deal with these forms. We set up a process. You know, the form comes in, it's reviewed. These are the bits, and the key things for us as well are around medication requests. So where patients are on regular medication, we have a policy in-house that our patient has to be reviewed either by our pharmacist or by a clinician before we start that repeat prescription ongoing. If there's a problem with medication, they can go back to their old surgery and get a month's supply, which gives us that bit of a gap. So just have a chat with your admin team first about how you want to process them, and actually it's pretty straightforward. I don't think personally there's much of a need for a formal training process. If anybody has any problems, we're here to help, so very happy to talk through with people as well, if that's okay.
We do have some demo videos on the resource hub, but we don't have an awful lot, as Ian said. We don't really have any proper training and courses on there. We are looking at what additional guidance we can give to practices, and I think we'd also welcome support from many practices who've got sort of their own best ways of working that they can share, because obviously coming from yourselves as a peer, it's probably going to have much more weight than it would do coming from the centre.
Oh, totally. We never listen to you guys at NHS England. We always do what we want.
Right.
That's fine. So
Nicola?
guys, sorry.
Oh, I'm sorry.
Oh, sorry, Adore.
I just wanted to quickly add, as much as we don't offer training, we do run some demo sessions that could support any practices that just want to understand the service a little bit more. So NACO and part of our other team, they spearhead this and tailor to suit a package that could support ICBs or practices, if the case might be, where we can just really break it down, because we all have different skill sets, and we appreciate that sometimes things are a little bit easier for others, but we're here to help. We're here to make it much easier for our NHS team and to do the job for you where we can or support you. Thank you.
Thank you, Adore. That's great. I just have one little last slide that I need to put up. If I can share my screen, if that's okay. Yeah, super. So just to end our session, because I'm very conscious of time, thank you so much to the guys at the NHS England team for coming online with us today and talking us through this. It's been hugely helpful, and I think it's one of those kind of myth busters that it's not as perhaps daunting as it might appear to be. I think it's important that we remember this is to use as well as for our patients, not instead of. There will always be people who prefer paper, and that's absolutely fine. We just need to be reactive, don't we, to what our patients need. And just as a final thing from IGPM, just remember that we are here to support you. We've got a number of WhatsApp groups that are ongoing where the conversation is often serious and not silly. There are some silly comments, which are great, but there are also some serious things. And feel free to join those groups. If you're a member, pop a question into the relevant group here and there. We've got loads and loads of support. And if there's anything that you would like us to do that we're not doing already, please do email us, info@igpm.org.uk. We're more than happy to put on sessions that we hope are relevant to you. I'm really, really grateful to you for giving up your lunch break. Who gets a lunch break? But I'm really grateful to you for giving us your time today, and we look forward to seeing you on another webinar. Thank you again, Ian, Richard, Adore, Nakul, Serena in the background there. Thank you. It's been really, really great to have you on board.
You're welcome. Thank you, Nicola. Much appreciated.
Thank you for having us.
No, it's been great to see you.
Thank you.
Take care, everyone.
Bye.
Thanks, guys. Thanks again.